Hello, my name is Ekam Singh and my student ID is 462736. In this video, I will show you the procedure of proper hand wash. So let's start. The very first step is to wet your hand under a clean running water. The temperature should be comfortable. It should be cold, hot, or whichever you prefer. Then apply a generous amount of liquid soap. Ensure you cover all the areas of your hand. Then rub your hands thoroughly and scrub for at least 20 seconds. Be sure to clean palms of your hands between the fingertips, nails, and wrist. The next step is to rinse your hands completely under the running water. Keep your hands lower than your elbows to allow contamination to wash away. Then use a clean disposable paper towel to dry your hands. Do not use reusable closed towel in the medical setting to prevent the recontamination. Use a paper towel to turn off the tap before disposing of it properly. Hello, so in this video I will be showing you regarding the donning and doing procedure. The personal protective equipment, which is also known as PPE, is protective wear required by the healthcare employees from coming in contact with the blood flows and the other potential infection material. Knowing the appropriate PPE to wear due to the potential exposure is critical for safety. Gloves are generally worn for any direct hand exposure. Gowns or lab coats would be worn to protect against any potential splash and spray or when dealing with a large amount of infection material. Safety glasses or face shield should be worn to protect against splashes, spray, and door plates, and the mask against the airborne transmission. So then we will start with the second step. So in this we will wear the gloves. So we will finally put on the gloves, put them over the gown cuffs to create a secure barrier to wear the glove. After wearing the gloves properly, we will take the mask and put it on our nose properly and secure our mouth by tightening the elastic loops over our ears. Then we will remove the mask and dump it in the biohazard waste and then remove the gloves in a manner so that we do not contaminate our hand and discard it in a biohazard bag. Then at last we will remove our PPE kit. In this video, I will be showing you the equipment cleaning procedure before the sterilization and wrapping properly. Cleaning and defunctioning of a medical and laboratory equipment are essential to prevent cross contamination and maintain a safe environment. So first of all, we will have to identify the equipment which have to be cleaned. So in this video, I have taken a frap which is heavily contaminated and there are also blood and blood fluids. So I have used a detergent for cleaning procedure and with the help of a cloth I will clean the equipment and under the tap water I will wash the equipment. Then I will put the equipment on the tissue paper for air drying. In this video, I will be showing you the procedure of autoclaving and wrapping of an equipment. First of all, we will sanitize our hands with the sanitizer and then we will have a pen we will have a adhesive tape, then will be having a sterilization indicator paper, and then we will have a seal bag, then we will have a equipment which is for wrap. Then we will take a cotton and put it inside it so it can sterilize properly, and then we will also put the sterilization indicator strip on the wrapping paper. Then after that we will place two scales of clay paper adequate in size to wrap items on the clean flat surface in a diamond shape with one corner on the paper facing towards you. Then we will have to place all the item in this wrapping paper square by folding the corner of the paper towards the center and turning a small corner back towards you. Continue wrapping the items by folding one side toward the center, leaving a small corner towards the back on itself. And then do the same with the other side as well. Fold the package up from the bottom and secure the folding to the last corner on the back itself. Wrap the package in. We will use the same technique for wrapping up the second paper. After wrapping up the paper, we will take the autoclave tape and wrap the item snugly. After that, we will put the adhesive tape on the wrapping so paper can be sealed properly. After sealing it properly, we will take the help of the marker and label it with the contact, like I write the date and the equipment name and put the initial on the last. After sealing the package, we will put the equipment into the autoclave for autoclaving. Now we will wait for the few minutes for autoclaving of the equipments. Until then, we will remove the gloves and discard it into the biohazard.